November 14th marks World Diabetes Day, and here at Nebraska Medicine, we can help people prevent, treat, and manage diabetes through our Diabetes and Endocrinology Center. So here to learn more today is Meghan McLarney. You're going to tell us a few things, what's new, and ways that people can basically mark this day on November 14th. So Meghan, by the way, is a certified diabetes educator and a nutrition therapist. So thank you for being here.
Oh, thank you, Kayla.
Okay, November 14th has significance. So why is that date picked for World Diabetes Day?
Well, November 14th is a world holiday, and in the diabetes world, we celebrate it every year. It marks really a dedication from the entire world, the medical community in the world, that we are going to be unified in our support of people who have diabetes. That takes on a lot of different shapes, but every year we have a new theme and show our support by wearing all blue. The symbol for World Diabetes Day is actually a blue circle, and so that's significant for us as well.
You mentioned the blue circle,
Yeah.
so people might be used to some of the traditions that we have around here at Nebraska Medicine, and these are things that are different this year, obviously due to COVID-19. So what do you usually do, and how are you changing things this year? Because it's a huge celebration for you and your team members.
It is. I definitely missed my calling to be a cheerleader in high school, but I found it in diabetes because every Diabetes Day, we form a big blue circle. Everyone wears blue. We'll go out and take a big group picture. All of the doctors, the nurses, even sometimes patients, people from around campus who really understand the support that we need for diabetes. We all join hands. We make a big circle in the middle of the circle drive, cause a big scene, take a picture, and post it to share our support. And people all over the world do that. So it's really meaningful to us. This year, we have too many of us, which is a great thing, a lot of supporters, to really get together with COVID happening. So we did a virtual circle and took selfies, and we posted that instead.
When we're talking about COVID, I think it's important right now because this is a condition basically that people, if they have diabetes, they're at greater risk for complications from COVID-19. And that's something you might be hearing from a lot of the patients that you work with. What advice are you giving them for how to protect themselves?
You know, I'm so close to my patients who have diabetes and their families that they really do share a lot of that worry. The research that is coming out about COVID and outcomes of COVID does show that some people with diabetes have a worse time with COVID, so they can struggle more with recovery and have more complications. If I had known at the beginning of the pandemic what I know now, I would have been so much more, I guess, on my soapbox about the value and the benefit of controlling your diabetes, of controlling your weight, trying not to gain weight, because obesity and high blood pressure can also complicate COVID. When you put those together with diabetes, it can make a darker picture, but all of us have control every single day on our health, and that is the thing about diabetes, is it is day in, day out management. So where you were yesterday with your diabetes does not have any influence on where you can be today. Every day is a new day for someone with diabetes to make choices throughout that day.
I like that, so people can feel a little bit empowered to take control.
Yeah.
There are some new ways, some new tools. Obviously, you guys are staying on top of research. So what is the latest when it comes to treating diabetes?
There is so much good going on in diabetes right now. And even just to pivot back to COVID, you know, our response to COVID has been to create more avenues of access, not fewer. So people with diabetes now can do telemedicine visits.
Yeah.
I never could have telemedicine visits with my patients before. They had to drive down to the diabetes center and make an appointment with me. And now we can do a Zoom or even a phone call if it's needed. I even teach classes virtually through Zoom. So people are getting to share their stories with each other and not just hear from me as the educator through Zoom. You know, that's one way that we're reaching out, but other innovations just in the field right now, really exciting. There is a lot more technology coming out. And technology can be expensive, but insurance is starting to recognize the value. And even, you know, just primary care doctors are getting really into this and starting to promote this technology. It's not just a specialty anymore. One thing is called a continuous glucose monitor.
Okay.
It's a little button that you just inject onto your arm or your belly, and it will actually constantly tell you what your blood sugar is. You can usually even view it on your cell phone or on a small device that looks like a cell phone. I have one on right now. now. I don't think you can
I
even
can't
see
even
it.
see it.
It's a little button. It's about that big. Didn't hurt to put it on. I'll keep it on for about 2 weeks, and I can get a constant update on my phone what my blood sugars are doing.
And that replaces, I think, a lot of us who maybe have friends or family members are used to those constant pricks.
Right. So I'm not poking my fingers anymore, which is good.
Let's talk about developments in diet, because I think that there's always so many kind of fad diets that come out and different things that are out there. And those of us who are at home more, because we're working from home, this is advice really that works for anyone. So what are you advocating as far as what are good foods to be eating to help control diabetes?
Right. Well, good nutrition is like free medicine, and it really optimizes any medications or devices that you might be using for your diabetes. So it's really important. But this last couple of years, we've seen a huge amount of change in the recommendations for diet for diabetes. So for nutrition therapists like me, it's been a really exciting time because I have more options for my patients that are evidence-based that work. And two of them, which are really one and the same, the plant-based diet and the Mediterranean diet. They're not new, but there are new guidelines really supporting them. And the plant-based diet is really just like, make half your meal plants and then work from there. Add more plant-based foods as you can. Learning what you like is the first step, so trying new things and focusing in on the things that you and your family like, know how to make, and that fit your budget. So one thing that we've done here is we've created a little bit of a pep rally around it. We have something called the Recipe of the Month. And the Recipe of the Month is always plant-based, so it's basically a Mediterranean meal. Doesn't mean that it has no meat or no dairy, it's just mostly plants. And it has to be affordable, easy to make, something that you could put together for you or your family, in less than half an hour.
Tell us about the Recipe of the Month that you brought in today.
Well, the Recipe of the Month, I actually asked my nurse colleague, Melissa Lockhart at the Diabetes Center, what I should do, because I wanted to do Mediterranean, but I wanted it to be fall and festive, because every November we do something around the Thanksgiving theme. And Melissa actually said, well, why don't you use sweet potatoes and cinnamon? Those are my favorite flavors.
Absolutely, great fall flavors.
Yeah, so the nurses are always the inspiration for the diabetes Recipe of the Month. So this month I actually made a harvest bowl. So it's Mediterranean in that it's plant-based, doesn't have added sugar or added fat to it in any large amount, and actually just steamed up a sweet potato and use that as the sort of the starch on a bed of kale and cabbage, which you can just buy pre-washed and shredded at the store.
You can make it easy. It's okay to take a shortcut every now and again.
I love shortcuts, yeah. And then you top it off with whatever fruits are in season. And right now, apples and oranges. Apples are coming, their season is ending and the citrus season is starting. So they're both super delicious and really cheap. So it's a deal, it's good for you. I added a handful of walnuts to make it more satisfying to stick with me.
Always a little crunch in a salad is a good thing.
Exactly.
And dressing?
And the dressing, I don't know if you can smell it, but the dressing is actually cinnamon and the juice of the orange that I used. When you squeeze an orange, you get all the oils from the skin. It smells really good. A tiny bit of olive oil and a little bit of honey, and then the secret ingredient is hot sauce.
I love hot sauce. It's a fantastic ingredient. It's a good way to add flavor without adding really any of that bad stuff, for sure.
Yeah.
For those of you who are interested, we'll go ahead and get this recipe and we'll put a link to it in the comment section. So look out for that, because it looks, even for people who might be like, no, plant-based, it looks delicious and it looks really filling too.
Yeah, it's got the crunch and the flavor.
So for people who are watching who may be diabetic, might not have heard of our Diabetes Center, and just are looking for ways to improve their lifestyle in general, what would you recommend as next steps?
Well, the thing I have to say to anybody who cares about someone with diabetes or who has diabetes or is fighting prediabetes right now is that you're an individual. And if you go to an expert, sit with a diabetes educator, nutrition therapist, an endocrinologist, you're going to get a plan that's tailored to you and tailored to your risk factors, to your goals, and really to what you can do now. So don't be afraid. It's not the same as it used to be, where the classes were one size fits all. Just reach out. All you have to do is call 402-559-8700, and they will get you set up.
Excellent. A great place to start, and a good opportunity now to kind of empower yourself to take control of your health as we recognize World Diabetes Day. So to everyone at the Diabetes Center, we talked about how different this is from this time last year. Thank you for all that you're doing to be safe, to keep your patients safe, to innovate things so that you guys do the work that you do virtually. So happy. I feel like I should make a heart and a circle with my hands to mark the occasion. So, and if people have questions, nebraskamed.com, you can search there for the topic to find out more information about how Meghan and her team can help you. So thank you very much for joining us.
Thank you, Kayla.
And I'm stealing a bite of that.
You can have a bite.
Okay. All right. Thanks to all of you for watching, and have a great day.